Health Alert Sierra Leone, a humanitarian organization that monitors, sensitizes, and advocates for vulnerable people to have proper access to medical facilities, has launched their findings on health service delivery in 5 districts in Sierra Leone: Tonkolili, Bonth, Kailahun, Falaba, and Western Rural districts, saying there were some cross-cutting issues like unavailability of ambulances, stock out of some drugs, PIN codes, misuse of global funds, among other things. So here in the studio to further talk on their findings, we have Victor Lansana-Koma, who's the Executive Director, Health Alert Sierra Leone. Good morning and welcome.
Thank you for having me this morning.
Okay, so in your words, I'd like you to tell us a bit about Health Sierra Leone, Health Alert Sierra Leone, and what is it you do?
Okay, so Health Alert has existed for over 15 years now. We principally work on health monitoring, as you rightly said, and we look at health service delivery. We advocate, we use a lot of approach, the smart advocacy approach. We do budget tracking. Of course, we want to see how much funds or budget allocated to the Ministry of Health and Sanitation in line with their budget target, 15%. We see how far government has progressed in that. We also look at issues around reproductive health. For instance, we work with youth and adolescents groups who actually want to see that we ensure that they access family planning commodities. We also look at issues around nutrition, and so all of these are part of our work when we actually engage the ministry, the district health management team. We collaborate also with the councils to see how far, because we talk about health also, health has been devolved to the local councils. So we also build capacity of local council finance officers, DPOs, to look at how aligned their plans are, in relation to the services that they deliver as far as health is concerned. And of course, we also work along with the media. Recently, we just trained the media on health reporting, how the media actually can report appropriately on issues around health, because don't forget, sometimes there are issues that has to do with confidentiality. So we train the media on how they report accurately on issues around health. We do a lot of governance issues around the health. Okay. So this has been our work over the period.
Okay, so is this the first research you've embarked on?
No. For every year, we produce our reports quarterly based on, our findings, whatever that we think is relevant for the public. We let them know, and of course, we do this alongside with the health stakeholders, like this report before it was published to the media. We held what we call the Social Accountability Forum, because that is part of a component of our activity, which we refer to as promoting social accountability in the health service delivery. So in all of these districts we have so far named, we made sure that the report was presented to all of the stakeholders in the presence of the district health management team. That means that it's headed by the DMO, the medical superintendents, the M&E officers who are also there, the district health sisters, and then the council, the chairman, or the CEO, whoever is available. We make sure we, present these findings to them for them to validate the report. So, we don't just publish the report like that. We want to make sure that this report that has been generated by our coordinators in these fields are ascertained by them. They also have the opportunity to challenge it. They have the opportunity to say, okay, this is correct or whatever. And then they all sit together and they make sure that those findings, probably with time, they are addressed. Those which they cannot do at their district level, they now have the opportunity to cascade it at national level to their authorities, right? There's a chief medical officer, there's a minister, whoever it is, to make sure that, yes, these are issues that they need to at least address. So that's how we do our work. So we don't just rush to the media. So they got that report first before the media was, was now briefed.
Okay, so with this current report, has it been validated already?
Oh, yes, the report was validated by the stakeholders in all the districts before it was presented to the media. So clearly, in fact, when the media publish, well, there are sensational stories, sensational topics, or you call them captions. Mm-hmm. So probably that go down well with some, some authorities, because I had a lot of call, oh, Victor, we saw this, like there was one hell that would say, oh, corruption in the health sector at Bond District. So that was so sensational, and somebody else would call me, Victor, but this was not what we discussed in the meeting. I said, well, I don't have authority to censor the media as to how they will use their captions. That's what is important. Go to the deep of the report and then go through what was written. If there's anything contrary to what was presented, then definitely we can also call that media to say, no, what you included in that report was not correct. That was not what was presented. So I can understand that, but I have no authority or power to censor the media as to how they use their captions. That's just that.
Zoomed through the report and noticed that most of your findings are quite disturbing, in all four places, five
yep.
Places. Clients complained about being asked to book and pay for health services, unavailability of ambulance services, in some cases, and insufficient beds for people to lay on. Which of these do you think is perhaps the most harrowing of all?
Okay, so let me narrow down to the one that has to do with ambulance service. I'm very mindful about this because it's critical. When we talk about health service delivery, referral is extremely very important. Now, let me start by commending the ministry. Commending them because over the period since 2019 to 2022, around 2022, our maternal mortality indicators was extremely very, very high. Of course, Sierra Leone was rated over the years to be one of the countries that has the highest maternal mortality. Okay, we were around something like 165,000, all over 100,000 since 2019 to that period I'm staying. Now, between 2022 to date, so much effort has been put in by the ministry and their partners, and as we speak, that indicator has reduced by close to 60–70%. Today, the ministry is talking about 443, all over 100,000 live births. But for us as civil society, it is still not enough, because when we talk about death, one maternal mortality death is crucial, right? And so we, in as much as we commend them, but there's a lot more that needs to be done to reduce that. Of course, we are not saying no death will happen, because this is natural. Death can occur anytime, right? But then, if the ambulance, which is supposed to be one of the necessities, right, that can help in transporting clients, pregnant women, particularly when they are in emergency situations, and ambulances are not available at a facility, there is a serious concern for the general public. And Mark, let me take you back. We got these ambulances during the COVID period, right? I remember vividly His Excellency the President, took these ambulances to all the districts. He launched these ambulances after the COVID. Almost all the districts got those ambulances to support and facilitate the process of referral, wherever the doctors might decide to refer the cases when they are in emergency situation. So if all of these ambulances we are talking about now, in almost all the districts we are talking about here, these ambulances are grounded, they are wrecked, they are not functional any longer. You go to the facilities, you meet these ambulances packed in the hospitals, right? For just minor repairs, maintenance.
You saw these ambulances?
Oh yes, I have evidences, I have photos. And I speak with facts. I don't speak with any sensational emotion, no. I have these evidences that the ambulances are there, they are packed, they are not functional. You go to by Hastings Airport, if you want to verify that, go there now, you see some of these ambulances also packed there. They are not doing anything. And these ambulances, according to the president, were meant to be in this district, make sure they manage them very well. But then let me also take you to the most important part here. The question you want to ask, who is in charge of these ambulances? This is critical for us. Now, we are made to understand that the ambulances were in charge of a separate entity that was kind of authorized or maybe contracted, if you like, to have, to be in charge of these ambulances. And the institution is known as NEMS, that is the National Emergency Medical Services. NEMS. NEMS is an institution that was kind of given that responsibility by way of contract with the Ministry of Health or with the government. I don't know the details of those contracts, but that's what we understood. So the question is, what is NEMS doing? So has the contract elapsed? Have they terminated that contract? Somebody was speaking to me, in one of our forum discussions, and somebody was saying, is it because at that material time when those ambulances came, NEMS was there were kind of huge dollars that were surrounding the running of that ambulance. You see them very active, they were very robust. The ambulances were running helter-skelter everywhere. So what has happened? Have we converted to Leone's now? Is it sense? Is it Leone's now that there's no more money in the whole thing? And let me tell you what is most worrying, Victor, Elizabeth, is the fact that patients are now being demanded money to buy fuel and pay DSA to ambulance drivers to convey them.
Victor,
this is so appalling and serious.
Just to hold you on your thoughts as we talk on the ambulances, there's also been a disturbing video that popped up on the internet, especially on the WhatsApp last month. Would like to call on our production team to actually play us that video just to support what you're saying, the constraints that comes with not having access to ambulance, especially in certain areas within even the provinces.
Yes.
Yes, so this Nigeria Moria, na a pregnancy woman now carry so we would go Nigeria because of lack of medical center. Now with the strain, a belly woman now would work out so. From here to Iraya, would work out by foot. We don't get no ambulance where they come for them. Now pass work out for good day. Health center now they, we don't even get secure policy with a medical, with the help with a this store. So they let the government see. Look at the majority where they work at this night. Today, na inside Iraya Mora, and they would so. Now the kind thing where they happen inside Mora and this so. Na bele woman I would travel so. By this 1 o'clock at night, wait tomorrow for B, pray day, and today we dey inside this kind pain and agony. We are with the beg on behalf of the government and other humanitarian bodies. They will not see to the strain and the pain. What them family they take. And the bele woman and the go so. Look at the people them where they go there. For go left Nigeria for the health center. Do you allow us see to this pain?
You have your comments on that.
So I will tell you, this incident happened at Kamandugu, Iraya, in the Falaba district. I have this video. This is fact. And this video was also sent to me by my coordinator who lives in Falaba. This is exactly fact, and that's what we are saying here. In these days of our age, we are talking about a modern life now, where issue about ambulance should be just smart, fast to address this issue, and yet we are going back to the dark days where patients are being conveyed by hammocks, by okadas. That is appalling. It is serious, and this is why we are here to talk about it. We'll continue to talk about it. We praise where the praises lie, where we know the government, the ministry is doing very well. We will let them know. We will let the public also know about it. But where the challenges are, so that's the question we are asking. Now we want to know, what is NEMS doing about this? Is NEMS still in charge of ambulance services? Where people are being asked, take for instance, a referral from Bonn to Bo, you have to pay 120 liters. Yes. And pay the driver 150,000 DSA. Wow. Right? Is it what is in the contract? We want to know. Or has they given up to government to take back the ambulance service? Referral from there to Freetown is 200, you have to buy 250 liters and then pay the driver 250,000. These are facts. Few days, this similar engagement was, the last session was held in Western Rural District. And then here again, people testify the same thing. In the presence of the representative, the DMO was invited, but apparently she didn't attend because of other pressing issue. Remember that the district health store was burnt just a few months ago. So they were up and about that matter. So she was not in attendance, but almost sent all the representatives, right, to that meeting. And again, it was testified there where patients confirmed to us that yes, they were still asked to pay for ambulance services. So we want to know, and we are talking about the free healthcare, yeah? The free healthcare since it was launched in 2010. We still believe that the free healthcare is there. And people like this nature, right? Pregnant women, lactating mothers, children under 5, are supposed to be the beneficiaries of the free healthcare. Is the free healthcare still working or not working? Is it finished? Has it been closed? Let the public know. These are the information I want the public to know. That yes, now there's no more free healthcare. The people have now the right to pay for the services, etc., including ambulance, right? All want the public to know that yes, these things are either free or not free. The ministry needs to explain this to us. Okay.
It's ironical because just before this point we were discussing how the ministry has tried to reduce maternal mortality. I just read a report from the ministry saying that they are fighting hard to reduce or keep maternal mortality under 300 by 2025,
yeah,
and ultimately to under 70 by 2030. But in light of recent events, I mean, the kind of harrowing, statistics, and the pictures you're painting here this morning, I'm not sure that's a reality that can happen anytime soon.
Absolutely. If the ministry is really determined and meant what it means here, that they really intend to reduce the maternal mortality by 300, over 100,000, which is what we are looking towards, right? But with this type of situation, are they really serious about it? Do they really mean it? Right?
I think at this point, whoever a names is or are doing a very terrible job. Ambulances, packed in the street, you understand. People are paying these huge sums of money, to access health care. It's horrific. It's a nightmare, particularly so in the 21st century, when medical services all over the world, not least other African countries, have tremendously improved. What do you think is the way forward to solving this particular issue first, ambulance service in Sierra Leone?
Exactly. So that's why we believe in what we refer to as accountability. There are people who are supposed to be held accountable, right? I don't know, you don't know who actually is responsible to ensure that this thing happens, but what we know, we believe there's a contract between NEMS and government. Okay. That we believe for sure. Has that contract come to an end? If yes, let the public know now. We have the issue about ambulance has gone back to government, it's no more in the hands of NEMS. But if that contract still subsists and exists, it means that NEMS should be held accountable. Who will hold NEMS accountable? The government, right? The Ministry of Health. I think it's about time for them to call on NEMS to say, what's this horrible thing that's happening? What's happening? And in fact, NEMS seems to be very quiet about this whole thing. I will tell you, in all of these engagements, they were invited in these meetings to confirm and make their position clear as to why is these things happening? What's responsible for this? Why are people paying? Is that the contract? Let the public know that yes, it's part of the agreement we had with the ministry that we are not going to take care. Look, our colleagues in the district also ensured they engaged the councils, yeah, because we also believe the council have a role to play. Because as we said right now, primary health care has been devolved to the council. But then you go to the councils, you know what the councils tell you? We have no budget line for fare. We have no budget line for ambulance maintenance because it's not under our supervision. They are not under our care. You go, you see these ambulances parked there. They are parked at the district offices, at district hospitals. That's where they are. And so we are not in charge of that. Is that the case? Right? So we need facts. We need actually real information for the public to know that who is actually going to be held accountable for this. Right? I think Again, the Parliament, the Oversight Committee on Health, for instance, Parliamentary Committee on Health also have a role to play here, because it's also their responsibility to make sure they call on the authorities of the Ministry of Health to explain this kind of situations. Why are ambulances that were donated by organizations, by institutions, by other friends, partners, others were also bought with taxpayers' money from Sierra Leone here? Why are they allowing such ambulances to be parked there without being used? Why is the public there who needs them are suffering, are languishing, being carried in a hammock in these days of our age? Those are the questions. So we are talking about accountability here, that some people have to be held accountable.
Our production team has reached out to the Ministry of Health, but are saying that they haven't read or received the report. I'm sure we'll have a chat with them subsequently, you know, on some of these issues we're discussing this morning.
So,
you know.
so one of the challenging things I would share with you, Vic, is the fact that at national level here, it's difficult to reach out to the authorities. We have made several efforts to make sure we engage them on this report.
You mean the Ministry of Health?
Of course. They know very well our work. We appreciate the effort they are doing. They also know exactly what we are doing. But we have a different mandate. They have their mandate, we have our mandate. So in the good partnership, we have always said to them, if you have anything to share, before we get to the public, we want to hear your own version of the thing. I have series of text messages and WhatsApp messages and whatever here requesting for meeting, either with the minister or the deputy minister or the chief medical officer. Trust me, they will not give you orders. But what we believe is a fact here is we are working at the district level. And that is why at the district level, the district head management team, which comprises of the DMOs, the medical superintendents there, the district head sister, are quite aware. So for us, we are comfortable because we have engaged them. They were part of this conversation in the district. We presented the report to them, and they have every opportunity to either vet the reports, I mean, before it was published to the media.
Okay. So now, apart from the ambulance and stock out of some drugs, what are the other findings in your report?
So again, there was this big issue about the PIN codes. You know, there was this huge pronouncement by the minister, several PIN codes have been offered, given to districts. Again, we try to verify how much PIN codes have reached the facilities. You know, we engaged the DMOs, the district health sister, to give us a data or kind of statistics of how much in their own facilities they got. You know, there were facilities who told us they got 20 PIN codes. You imagine where you have over 100 or let's say 50 or 100 personnel, and among them over 50 are volunteers. To just give 20 PIN codes, 25 PIN codes, it doesn't make sense. That's not just enough. Meaning you are still, it's a recipe for what? Those others who do not have PIN code, but they are yet in the facilities, you are in other words telling them, exploit the patients. Because how do you want them to survive? Without PIN codes means you are not on salary. And so these are the ones you will find in the facilities who will be doing all sorts of dubious things, selling medicines, you know, unofficially to patients, demanding money, right, by any means, right? And that's why Victor and Elizabeth, I will tell you, the data is there, the records are there, the findings are there. The out-of-pocket payments is so huge, it's over 40%. Meaning, monies that are coming from the pockets of people, citizens, to pay for services, that data is there. It's with the ministry, they know it, that it's high, right? And so all of these things are the concerns we are raising. So PIN codes was one of the other things we discovered, that there are not sufficient staff who have received PIN codes, right? It's a big challenge in almost all the facilities that there are not enough PIN codes, which means government needs to release that up. And so the ministry cannot, definitely we know they are constrained, they are challenged, and that is why we are also partnering with them to raise our voice to ensure that the budget for the Ministry of Health is increased. Honestly, I mean,
do you think they do not have enough funds?
They can, definitely. From the part of the government, okay? On the part of the government, the Ministry of Health is still underfunded. This I will tell you for free. They are still underfunded. And don't forget, these governments, when I talk about government, our government, whether it's previous government or current government, they have signed to treaties, they have signed to international agreements, and the Abuja target is saying every country should be able to provide 15% of their budget from the national budget on health. Where are we? As we speak, Sierra Leone is not even up to 10%. But let me also tell you the whole issue there again. They will tell you, Ministry of Finance will tell you, we have allocated 10%. But in actual fact, when you talk about disbursement, it's around 4%. That's sad. That's extremely sad and appalling. We are not catching up with other countries outside who we are part of this signatory. All right? So if you don't provide adequate resources to the Ministry of Health, and the ministry is largely depending on donor funds, right? When at this time we are talking, donors are almost like sick and tired to continue to support the ministry. When ministry is not taking leadership, right, in its own funding, it's in own supporting their own healthcare and depending on donors. That is appalling, okay? A lot of other agreements that the ministry has gone into, for instance, you want to talk about the compact agreement as well. The ministry went into compact agreement with the UNFPA to provide family planning commodities. They signed that. The Ministry of Finance was part of this agreement. They signed, where the UNFPA say, okay, government, you provide 1%, and then we will provide 4%, kind of like match funding. Okay? As we speak, government has not fulfilled its own 1%. How do you want UNFPA to continue to procure commodities, family planning commodities, when after an agreement has been signed, and you renege on your part of the agreement? These are the kind of things that are happening. So I think government needs to really step up and ensure that when we talk about, protecting the life of our citizens and the young people, and there is a high rate of teenage pregnancy, by the way. You go to the teenage pregnancy secretariat, they will tell you the rate of teenage pregnancy is on the increase. Why? Because family planning commodities are not adequate, right? They are not accessible to the young people. Okay, and these family planning commodities will help in reducing what we talk about maternal mortality, because as long as they take them, it will prevent teenage pregnancy.
Even with the dependence on donor funds, as you've mentioned, your report also goes out to highlight misuse of global funds. Can you elaborate on that?
So, if, for instance, the Global Fund has provided funding to provide healthcare services, reproductive healthcare service, which include even this. So the question I want to ask here is, why should patients be demanded again to pay for services that have already been paid by a donor, for instance? Okay? Well, actually, it's not Global Fund. Maybe let me correct that. It is the Global Financing Facility. The names are almost like synonymous, but it's GFF. GFF means Global Financing Facility. This is a World Bank funding, okay? It goes to World Bank, and then to this district, okay? So if this fund is there, why can't them be using part of this fund to support the running of ambulance, for instance, maybe to do so? It's not always that they are doing referrals. When referrals happen from those facilities to higher facilities, it's not like it's happening on a daily basis. So I would have thought that if they have these resources given to them, because after all, it's about reproductive, maternal health, everything, which includes pregnant women, okay? Teenage, for instance. So if patients are being demanded to pay, then the question we want to ask, what are they using that money for? Clearly, even if you don't say they are misusing it or mismanaging it, but if the purpose for which this money, part of it is supposed to be used to do that, and you are not using, rather you are demanding from the patient to pay, then clearly it shows that you are misusing them, right? So that's exactly our position. So we want to know how much and what this monies, the Global Financing Facility funds from the World Bank, is being used for. Again, Victor, let me tell you, I also have issue with the World Bank. This I will say clearly. Okay. Yes, I want to say this clearly. Because again, we had this report, we approached the World Bank because they are the ones that are giving this money to the ministry, right, to support health service delivery. before we even went to the media, we had time to engage the World Bank country team in Sierra Leone, at least to have their opinion on this report. They turned our appointment all down. So again, we hold them accountable. If they are receiving funds, and on behalf of the people of Sierra Leone, and those funds are being given to the sector, I think they have a responsibility, right, to ensure that those monies are being utilized the most effective way. If we as civil society will have gone ahead to at least organize ourselves, right, to follow up on those services, and yet have something to share with the World Bank, I think they have every need, right, to at least give attention to us, which they failed to do. So I will also barely hold them also accountable for failing to also follow up on these services.
In the report, you also mentioned that you had issues with malnutrition. Across all of the 5 places you went to, malnutrition was at the top of the chart. There's a problem in all of these places. Do you have statistics to speak to the rate at which malnutrition is ravaging these places? So
malnutrition is key because we know, yes, the directorates for RCH, of course, it's under where you have the nutrition directorate as well, or directorate manager as well. But of course, we always do this alongside with other civil society organizations like the SUN platform, the SUN CSOs, scaling up nutrition and immunization, and of course the public in their own opinion, right? They notice that commodities such as plumpy nuts, let's be specific, for instance, plumpy nuts. Plumpy nuts are meant for malnourished children, right? Children with either kwashiorkor or marasmus, whatever it is. But again, the report find out that this plumpy nut is being sold to the public, right? It's been sold. You go everywhere, you find this plumpy nut. And where are they coming from? For all you know, you are coming from the facilities. Who is selling them? The ministry is quite aware of this. On several occasions, right, okay, they will also say we'll blame the patients, because when the patients go to the facility and collect them, right, they will, instead of giving them to their kids, children, they will rather sell it. But then so again, that says there's not adequate either monitoring, or there's no adequate sensitization or counseling for the parents to know that these things are meant for your kids. If it is given to your kids, it's not for sale, right? Just like bed nets, the same thing. Bed nets are distributed for malaria treatment and whatever it is, but you go there, you find this bed nets being misused outside.
But with regards to the plumpy nuts you've just mentioned, it's being sold in larger quantities, and I don't think parents receive that amount from the hospitals for their children.
Absolutely. So this is where our suspicion is. They may be coming from the facilities. For somebody who may be handling them, those commodities may have been coming from them, because as you rightly said, if they are there in the market in the large quantity, and which is not the quantity that is given to the relatives, then we begin to believe that there somewhere within the facilities these things are coming from.
So these statistics, these findings are in a way mind-boggling, disturbing, teary, and traumatic at best. The question that has been illuminating my mind ever since we started discussing this morning is, why has indeed the ministry not granted you audience to speak about some of these things? What's exactly the issue between your organization and the Ministry of Health, considering the kind of job you do? I mean, I feel research is one way we can improve health in Sierra Leone.
Absolutely.
These are real-time statistics.
Absolutely. So, Victor, this is the question,
so
and that's
what's the problem? What's the problem?
That's exactly the point. So always I would say, the perception about authorities there, they always believe that as long as reports do not come from them, they don't just want to rely on any other report that comes.
Have you ever approached them with these reports?
Oh, yes, yes. Like I told you, Victor, on several occasions I have contacted them to say, no, we have something to share with the ministry. Can you please give us audience? On several occasions, I have been in the meeting where I am invited in their meetings. And I will say to them, okay, we really are looking forward to the ministry giving us opportunity as civil society. You know, you guys, you are doing quite a lot. We are hearing you. You have a media engagement and that kind of thing. Today, it's your turn to come and present. That's what I have asked them on several occasions. When you are making this agenda, when partners are presenting, when your district coordinators are presenting, your district officers are presenting, your DMOs or whatever, will you please also in your agenda give opportunity to civil society? You know what? Civil society has been talking a lot. They have been saying this. They have been. Can we give them audience? Can we give them opportunity? Let them also do their presentation. I mean, it's an opportunity where you have the right to critique, to even say, no, civil society, we don't trust this information, we don't rely on this, or what you are saying, you are not correct. But if you don't give us audits, and yet we believe we are doing partnership, we are working together. You know, whatever we are doing here, we are, by the way, we are not doing it to cry the ministry down. We are just complementing their efforts. We are trained. We know they are also challenged, like I've mentioned. We know the ministry is under-resourced. We know the ministry is not getting the adequate finances that it's supposed to receive from the government. This we know very well. And that's why we are saying we are also part of you, to join you, to complement our effort, to say, in fact, we need more money. We'll talk to the donors, we'll talk to all other partners, including government, to make sure resources are available. But if you don't give us audience, you don't give us time to talk to you, to present our own little findings to you, then what's the partnership, right? Is it that you only call us when you need us, and when we need you, you don't pay attention to us? Is that the way? That's not how partnership works. Partnership works in two ways. When you need me, I come. When I need you, you should come. But for us, Victor, I will still say we are not worried. The reason is because we are working at district level, the DMOs, the council, who we are all working together, are part of our engagement. So I will not say the ministry do not want to pick, kind of is not working with us, or do not give us audience. If the authorities at national level do not want to pay attention to us, they don't want to work with us, at district level, we are working with them comfortably, and we are okay with that.
I think at this juncture, I would like to sound some of your views, which you've been sending on Facebook. For all there are, messages on our Facebook page, and see indeed what you've been saying concerning the discussion we've been having this morning with the Executive Director of Health Alert. I think it's Ronald Beresford Ignatius Georgestone says, go to the scrapyard and you'll find out that these ambulances, parts and engines have been removed into other vehicles, and there are ambulances in the compound of some officials, just as tractors meant for farmers ended up in ministers' compounds, and yet nothing is done in addressing the mismanagement of state resources.
Still from Ronald, he says, like always, nothing will come out of this discussion as long as it has found lapses in the health sector. My dear sir, keep your findings for the day of reckoning. As you know, there's no Auditor General to keep tabs on mismanagement or thereof, so only time will tell, but this is Sierra Leone in a nutshell.
Victor Ako Mengot, when we address the issue of reducing maternal mortality, we should take into consideration the 3 delays, especially when emergency obstetric care is required. Delay in deciding how and when to access specialist care, the delay in the provision and availability of transport, delay in providing care when the patient arrives at the facility, and that in turn depends on the availability of equipment, including oxygen if needed, electricity, and specialist staff to administer emergency treatment. Community outreach is also very important to identify those that may require such treatment at the critical hour.
Sweetsman is saying, I support the statement of the honorable man in the studio. Government has a lot to look into in our medical services. When you don't have medical problems, you can't know what is happening in our hospital. Until you have health problems, before you will know the circumstances sick people are going through in hospitals. Our medical system is collapsed. All our medical sector is poor, and the poor quality system has contributed to so many deaths in the country. It's a long message.
Usman Prince Suleiman Kavon, we are running a stateless state that lacks structural roadmaps, framework, blueprints, goals and plans. We have departments and government agencies wasting taxpayers' monies without doing what is necessary to to perform their duties. We need a robust auditing, quality control and assurance to monitor government and governance activities to keep track of public affairs delivery.
Mohammed F.S. Kamara is saying, if you want a PIN code in the nursing department, be ready to pay 2 million leones or you continue to wait for 10 years.
Emil Davis saying, firstly, has the report been validated? Secondly, who is responsible for these ambulances and why should patients pay for the facilities of these ambulances? What happened to the free health care? It's disgusting for someone to pay for a facility and can't enjoy it. This is so sad. No transparency being showed for the funds being paid. Clearly no accountability. It's high time we stepped up. Health is wealth.
Osman Prince Suleiman Kavoni says, we're running a stateless state that lacks structural roadmaps, framework, blueprint, goals and plans. We have departments and government agencies wasting taxpayers' monies without doing what is necessary to perform their duties. We need a robust auditing, quality control and assurance to monitor government and governance activities to keep track of public affairs delivery. I have asked to help creating a system that would help with how we conduct public affairs business activities, processes, procedures, modules, and models.
Mystic of Dozak is saying, Victor, collaborating is good in as much as you are contemplating their, complementing their effort, highlighting their challenges is important because it will help them to be proactive rather than be reactive.
And lastly, from my side, Mohammed Jallo says the workers are not getting paid, so they pay themselves by stealing the good meant for the hospital and the patients. Okay, it's salon. People are working for free without salary. What do you expect? They pay themselves by asking patients for money or stealing the drugs and other things.
Last one here, Osman Prince Sulman Kavon again. We should keep a data records of all medications donated or bought by the government. Monitor how many of the medications that has been given to the patients and what has been disbursed to different government, private and other beneficiaries. Victor? Yes, which one of these would you like to start addressing first?
Yeah, thank you very much, Vic. Again, yes, somebody talked about the 3 delays. Yes, this has been one of the defense on the part of the ministry. Out of these delays, there are some which, they also attribute to, the community or the parents, taking decision as to whether they should refer or not refer on time. So they believe most times by the time the relatives or the husband take this decision, it would have been too late for the patients. They come now in the very moribund state, in the almost last stage of their life. So the other second delay, somebody says, they always say when they come to the facilities, are there adequate equipment, are there time, are the health workers very prompt to receive the person? Again, yes, it's a big challenge there because somebody has come delayed now already, and we start to also ask, where were you, why are you coming only all this time? And those things, leave them, attend to the patient on time. The patient has come late, yes, we agree. Stop wasting your time to be asking. But one other crucial part, which somebody said about our general health treatment. Now, let me take you back. I remember when His Excellency the President was in Parliament, he did mention he wants to ensure that we have a modern class hospital in the Western Rural or somewhere about around Kerita or whatever. What has happened to all of this plan? It's crucial. So let me tell you one thing. Let me give you one information, which is sad. And that's the reason why we are still not taking our healthcare serious here. If you go to the Ministry of Health budget, Victor, one of the huge budget line that is taking away the minister's budget is overseas travel, overseas treatment. Overseas treatment. I'll tell you, I was in the last year budget hearing at the Ministry of Finance. The Ministry of Finance says, guys, you need to find a way to address this issue. This is becoming so much burden on the economy of your budget. Why do we have huge money there for overseas travel? So this is the question. And when sometimes I hear politicians talk about, you know, we are doing this, we are doing that, and yet behind the scene, we know what's happening. They are not taking our healthcare serious because they know there is money there which they can use at any time. So who is taking that decision to take these referrals to make sure, okay, I mean, for all you know, we don't even know who are these people. Are they politicians? Are they families of politicians who are going for this overseas travel? And so these are the things we are talking about here. If this type of actions or whatever, the public takes such action to say, you know what, we will have to stop, or the Ministry of Finance will have to stop all overseas travel. If you have money, you want to go outside to Ghana or wherever, pay your own money. Don't depend on our state resources.
Well, I believe there is the Anti-Corruption Commission, and perhaps some of these issues will form a very busy day for them.
Well, you know, it's up to them to investigate who are actually these people that are carrying our huge money in the Ministry of Health budget for overseas travel. Is it the reason why they are not paying attention to make sure that we have healthcare? For everything they do, you have to go to Ghana, you have to go to India, you have to go to here, you have to go to where? Why?
Well, I think at this point, it will be nice for us to fix context to our discussions regarding your report. So,
I was just responding to the Texas.
Okay,
because there was a Texas who was talking about, I mean, as a country, we are not taking care of
monitoring and all that. Yes,
you know. So I was just responding to that.
Okay, well, finish up, please. Are you done?
Yeah, I'm okay. I've just responded to the text message.
Right, so let's fix context to our discussion.
Okay.
I mean, fixing perspective to your report further. What are the recommendations?
So, so again, we have made clear recommendations that one, these findings, I mean, whether they accept them or not, for us, we believe they are facts. It's up to them to go and find out. We have evidences, but it's up to them. But then, take for instance the issue about the ambulance service. I think government, and that's why I think I have called on even the members of Parliamentary Committee on Health. I think they also have a role to play. We are asking the Parliamentary Committee on Health to do an oversight visit to all the facilities to ascertain our report as to whether, yes, it is clear that, yes, ambulances are not functional, with the exception of few, very few out of the lots we are talking about here. And the few ones that are there are the very ones that are being exploiting our clients, our patients, because the others are not working. So the Parliamentary Committee we call on them to make sure they ask the Ministry of Health and NEMS, why is it that the ambulances are parked and not functional? That's one recommendation. And the second one has to do with, of course, making sure that the ministry itself step up in ensuring that they do adequate oversight or monitoring. They have their M&E officers. They are all over there, right? I'm not sure whether they are presenting these real-time reports to them. I'm not sure. But if they are doing, then the recommendations that they are also doing, how far are they implementing them? You know, we know the challenge around stock out of drugs, that we're quite aware. But of course, again, that's one of the big problems, that if we only have few entities that are procuring drugs on behalf of the state, on behalf of the ministry, then that's also a big challenge, right? The commitment on the part of government to fulfilling their part of the obligation is another key thing, right? That if government has committed to say they will provide this, for instance, with their counterpart or whatever, I think the Ministry of Finance needs to do everything possible to make sure the healthcare sector is well resourced. They have the resources that they are requesting. But it's not good to say we have allocated 10%, and when it comes to disbursement, they disburse only 4%. I think that's unfair. So we also made the recommendation that the Ministry of Finance needs to ensure that if they say they are allocating, they should disburse all of what they have said, because the ministry has requested. This is what they say we want. They know the reason why they want it, and they know all the areas where they want to make use of this money. But if you give them less than what they are requesting, it's like you are telling them, leave the other areas, they will have to reprioritize again right? And in the event, they will leave areas that are more vulnerable, they should be paying attention to. So I think the Ministry of Finance also made a recommendation that going forward, each time the ministry makes their own, I mean, it's not good to call them, come and defend your budget. And sometimes we are called there as civil society to help defend this budget. But after all, government will tell you we don't have enough money to give, so we just give this amount, which is unfortunate. So there are key ministries that they should be prioritized, like the Ministry of Health. Ministry of Finance should be able to prioritize the Ministry of Health at all costs in making sure that they provide adequate resources for them. So we have their own recommendations as well.
Okay, so now as we try to wrap up this conversation, how does Health Alert Sierra Leone plan on, monitoring and doing a follow-up on some of these findings that you have already?
So we have a strategy of following up on this because, like I said, all of these things happen in the provinces. Our colleagues, as part of our post-report activities, they will keep on following up. We have presented to the media, kudos to the media for raising all of these things. We appreciate so much. In fact, that's the reason our partnership. And by the way, for information, each time we are doing this monitoring, when we are sharing these findings, we always make sure the media is part of it.
Okay.
Right, that's one thing. So we appreciate that collaboration with the media. But then we'll also continue to do the follow-up. So I'm sure anytime soon, as long as the opportunity avails us, we'll also follow up on them. But we have given them a bite. It's up to them to see which one they can take.
All right, thank you very much, Victor. He's coming from Health Alert Sierra Leone, and of course he's talked about their findings, which we've discussed here this morning.
We want to thank you very much indeed for gracing our program this morning. As I said earlier, some of these findings are hair-raising at best and teary, in a way, very traumatic. So, but we hope to have, the Minister of Health to come to the AYV or find a way to speak with us about some of these things you've presented to us this morning. And as you've said, you are challenged, in a way, because you're not being given audience. Yeah. But since we have the audience, we'll speak with the minister, and maybe he will fix context from their perspective on some of these things in some of our subsequent programs here on Wake Up Sierra Leone, or some other news program we have.
I would love to be part of that. If the minister consents, I would also love to be part of that.